the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Benefits of home-based care for individuals with HIV and AIDS. From a small corner in Africa, the HIV virus has spread to practically all parts of the globe and is now considered a pandemic. In the United States, about 1.2 million people are infected with the virus. Since 1981, when it was first identified, HIV and AIDS has also claimed 30 million lives. Continued research since the 1980s up to the present has resulted in the development of potential antiretroviral medications that slow down the virus, if not to cure the disease. However, in many countries, lack of information, inadequate resources, politics, sexual lifestyles, and the overall stigma about HIV and AIDS continue to reverse gains in tackling the disease. Entire countries and economies have suffered greatly because of HIV and AIDS, and the prevalence especially in poor countries. Even in the U.S., where healthcare is supposed to be world-class, HIV and AIDS continue to be a big public health issue. On a more personal level, individuals and their families who suddenly face an AIDS diagnosis feel helpless and scared because prognosis is not good overall. Yet, if caught early with proper medical intervention, AIDS can be manageable and patients can expect to have longer, more productive lives than earlier thought. What are the symptoms and treatment? HIV is spread through sexual contact, sharing of needles with an infected person, or through infusion of HIV-contaminated blood. It can also be transmitted by mother to child during pregnancy, delivery, or through breast milk. Contrary to common notions, the virus cannot be spread through saliva, urine, sweat, tears, or feces unless these are contaminated with blood. Infection starts with flu-like symptoms like fever, headache, sore throats, mouth sores, and body rash ranging from 2 to 4 weeks. This is followed by a silent period that averages about 8 years, where the infected person feels no symptoms at all. Later, the person will experience weight problems, stomach issues, and muscle aches, and will later progress to AIDS. If the CD4 T cell 4 count drops below 200, there are usually concurrent opportunistic infections such as respiratory infections, particularly pneumocystis pneumonia, wasting syndrome, candidiasis, and cancers like Kaposi's sarcoma and Burkitt's lymphoma. The immune system is broken down by the virus, and many organs are affected when the person has AIDS. Fatalities are caused by these complications. Home care services. There is no substitute for adequate medical care for individuals with HIV and AIDS. However, you can run into insurance issues, financial constraints, and time management problems when faced with caring for a family member with AIDS. You are also likely to have concerns regarding your personal health and may not be so open to being the primary caregiver. Those are expected and understandable concerns which can be addressed by getting home care support. Home care services can free up valuable time and alleviate your fears of caring for an infected loved one. It also allows flexible care in a more nurturing environment that is your own home. How can PCAs or professional caregivers help you? First, information and awareness. Much of the fear comes from not knowing enough about HIV and AIDS. PCAs are trained to be knowledgeable about this condition and can dispel any myths and misconception about HIV and AIDS. They seek clarification from health professionals for a complicated question. If your family needs basic information, the PCA at home can reinforce the education learned by the patient from the doctor or nurse at your last doctor or hospital visit. Activities of daily living. PCAs will assist with activities of daily living such as bathing, grooming, dressing, eating, toileting, and performing a physician-directed home exercise program, for example, range of motion exercises. Home care workers are also prepared to extend with the so-called instrumental activities of daily living, which includes housekeeping tasks, shopping, meal preparation and cooking, and transport to keep to the doctor's appointments. They also assist patients in moving about safely with use of walkers and other assistive devices. Personal hygiene. Those who are at an advanced stage of AIDS are so weak that they are unable to take care of themselves physically. PCAs are there to assist in maintaining personal hygiene at all times. They understand that hygiene is important to prevent infection in a person with AIDS because the immune system is compromised. If you are concerned about being infected, some tasks can be delegated to a hired personal care attendant. Comfort measures. People with AIDS experience a great deal of pain, and comfort measures are provided by professional caregivers. These measures can range from giving pre-approved pain meds, massage, changing soiled bedding and clothing, aromatherapy, and other activities that promote relaxation. Comfort measures are especially valuable in palliative and end-of-life care, where a pain-free feeling is paramount in the last days of the patient. There are many medications to be taken by a person with HIV and AIDS. These can be confusing to remember, and some simply refuse to take them because of the side effects. A PCA working under supervision of a medical professional will make sure that every medication gets taken by the patient on time with his or her consent. Some functions, such as blood pressure taking, blood sugar monitoring, or providing inhalers or oxygen during labored breathing, can also be performed by these personnel. Emotional support. PCAs and professional caregivers are good communicators. They know what a diagnosis of HIV and AIDS can feel like, a death sentence for many people. Public stigma bring about social isolations, and many patients are plunged into depression. PCAs are available to talk even when you are not around. They are there to listen and to talk about the patient's feelings about HIV and AIDS and encourage participation in their own care. PCAs have a great positive attitude that they convey to your loved one. Monitoring and referrals. The PCA is there at their side to monitor and observe for physical signs and symptoms that indicate some type of deterioration or emergency situation. PCAs and home health aides are trained at administering basic CPR and know who to contact for help in case of an emergency. They also make note of any new symptoms, which they can report at the next doctor's visit. PCAs are trained to coordinate with all members of the care team for the HIV and AIDS patients if the need arises. HIV and AIDS cases are expected to grow in the coming years despite advances in treatment. A family member or a close friend may be one of the unfortunate ones to be infected. Caring for people with HIV, especially with full-blown AIDS, can be financial, emotionally, and physically draining. Thankfully, there are many resources available to ease the burden, including home care services. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.